and welcome to this very special episode of Young Turks Ideas Without Boundaries. I'm Shireen Bhan and we're coming to you from Bangalore. We're here because of India Sociopreneurship 2010. What is that exactly? It is an event that's brought to you by Young Turks in association with our online partner, yourstory.in. It is a platform for social entrepreneurs to showcase their ideas, hopefully walk away with some recognition and even some funding. So here's a quick glimpse of what we have lined up. Over the next 30 minutes, we bring you 15 entrepreneurs who put their ideas to a panel of investors and have everything from their business models to revenue streams assessed. Well, it's starting to rain outside, but it's raining social entrepreneurs inside at the Sociopreneurship India Awards 2010. Here's a quick glimpse of our shortlisted finalists. The tech duo of Rajiv Kumar and Samir Savarkar have a remedy to bridge India's rural healthcare delivery gap. Engineering graduates from agricultural families, they began neurosynaptic communications in 2002. Remedy, or Remote Medical Diagnostics Kit, facilitates basic healthcare that is affordable and available to all. This innovation in a box can be set up in villages with basic internet connectivity. Using basic ICT software, the device measures 5 basic physiological parameters like temperature, blood pressure, pulse rate and ECG that allows real-time distance diagnosis between rural patients and urban doctors. Currently set up in close to 100 locations across UP, Tamil Nadu and Tripura, the Remedy device allows a doctor in the city to remote control the consultation and get real-time vital parameters for diagnosis. Providing consultancy for as low as 50 rupees, Neurosynaptics telemedicine tool is bridging the urban-rural healthcare divide.
Putting together a solution that works on 2 watts of power, putting together a solution that works on 32 kilobits per second kind of connectivity, which no other solution to my knowledge works with audio, video and real-time medical data transfer. Then putting together various processes which actually make sense for the rural healthcare delivery, putting together training modules to make sure that the skill set that is locally available gets capable enough to handle the local healthcare needs, and connecting to the doctor at the back end to make sure that the need is satisfied appropriately at that place, and all of that at a price point which is affordable to the villager.
Another venture betting big on low-cost healthcare innovations for rural markets is Forest Healthcare. Founded in 2010, its patent-pending technology, Trinetra, is a pre-screening ophthalmology device that provides early detection and diagnosis of eye ailments. Costing only a fourth of similar setups available in the market in its beta phase, Trinetra has been installed in 2 rural locations. Forest is now looking at a retail foray of this device in early 2011, and the 5-year vision is to deploy 10,000 such units across India and reach out to 1 million+ patients.
We're trying to develop a data center through which we will be connecting many stakeholders. It could be a district hospital, it could be a primary health center, it could be a rural entrepreneur who's offering a services, it could be an ophthalmologist who's having a practice, it could be a general physician or a diabetologist. They will all be connected through our data center, and there would also be service providers. There will be service providers who provide services let's say, providing glasses. They could be providing pharmaceuticals for glaucoma patients. So this is the kind of service we want to integrate, so that a patient who or a customer who walks in actually should get a solution when he leaves.
Giving solutions in financial security to clusters of urban poor and migrant population is Invest India Micro Pensions. Founded in 2006, the venture offers pension plans to the unorganized working population excluded from the net of social security schemes. Set up with equity investments by UTI AMC and Seva Bank, IIMPS charges micro contributions ranging between 100 rupees to 500 rupees every month from its members, and in return offers pension schemes at 10% on their investments. Recognized by the PFRDA to promote its national pension scheme, IIMPS has reached out to 2 lakh working poor spread across 9 states in India.
Over 200 million people are in the low-income workforce, and if you look at pension from the supply side, this market is untouched. Nobody is actually reaching out to this audience for a pension product. And when you look at this in the context of the fact that India is a young country where majority of people are below 30 years of age, then this population has some saving ability. They can save, and as the years will grow, these people will only improve in terms of their income profile, and therefore will only be able to save a little more than what they are able to do now. So if we are able to make these people join the scheme and join into a savings habit for their old age, then I think this is something that we are looking at from the point of a market.
Parag Gupta has been associated with social entrepreneurship in India for a decade. A former associate director of the Schwab Foundation for Social Entrepreneurship and a fellow of the World Economic Forum, in 2008 Parag chose to strike the path himself. His initiative Waste Ventures provides waste pickers a lucrative method of processing collected waste. Supporting them to sort garbage into recyclables and composting organic waste into biofertilizers, Parag ensures that their labor is not free but fee for service. Helping waste pickers form corporations, aggregate investment capital and sell biofertilizers and gain carbon credits, Waste Venture provides this vulnerable section of the society access to additional income. With its pilot project live in Bokaro in Jharkhand, Waste Ventures has incubated Nidan, an NGO to start up its efforts.
In 3 days, urban India produces a mound of garbage that weighs as much as the Empire State Building. So it's a phenomenal amount of garbage that right now only about 60% of it is being collected. So 40% of the garbage is just lying in the streets, lying in the open within urban cities. Now we can transform that garbage into more of a $2 billion, right now it's a $2 billion market opportunity that's being missed out in terms of what can be composted, what we can earn carbon credits on, and what can be recycled.
The education sector has been an opportunity closely tracked by entrepreneurs. Ganesh Subramaniam and Chitra Ravi launched Easy Vidya in 2001 to log into this opportunity. The team designs and develops content for K-12 curriculum and has provided the same to over 500 private and public schools across India. Easy Vidya has partnered the American India Foundation, Wipro, IBM and the Azim Premji Foundation to touch the lives of over 2 lakh students. Cash flow positive since 2008, the venture grossed a turnover of over 8 crore rupees this year, and now Chitra is looking at a global foray of Easy Vidya's products.
We realize that scalability is the key for not only sustaining but for the kind of impact that we would like to make. And when you're looking at scalability, we know that today it's possible for me to sit and make very realistic statements that we can scale to a 10x growth thanks to technology.
Our next entrepreneur, Pavitra Vyas's vision is to provide India's disabled population equal work opportunities. Having worked with the specially abled in government-run NGOs, this 26-year-old along with her husband decided to turn their efforts into a business where being disabled is not a disqualification. So began Vindhya E-Infomedia in 2006, where differentially abled employees work on web-based services, data entry, data processing and digitization of records.
The recent plan is we want to be a 3 crore company with 300 people. The expansion plans which we are looking at is we want to definitely expand to Chennai. And we would want to go and expand in north part of Karnataka, where we feel that the disability population is really very, very high. The sectors which we are planning to target is definitely BFSI and microfinance, which is a growing sector, and insurance sector. And we are planning to also venture into a new sector where it's security monitoring system.
Partnering with the state government of Karnataka and NGOs like Enable India, APD Bangalore and Anubhuti, Vindhya conducts camps and workshops in villages where the disabled are trained in basic computer skills. Vindhya already has 200 people on its rolls to serve clients like Wipro, MetLife, Ujjivan Microfinance and IndusInd Bank. Pavitra is also hoping to gross a turnover of 3 crore rupees this year. It's time for us to take a very quick break on this special episode of Young Turks Ideas Without Boundaries. When we return, the action continues from Sociopreneurship India 2010. More finalists and more inspirational success stories.